Hi, my name is Nicole and I am an occupational therapy student from the University of Minnesota. I completed 10 weeks of fieldwork at Open Circle and I'm here to bring you an exercise video that can be done between caretakers and their loved ones. The benefit of this kind of exercise is that it makes it a little bit more interactive and direct. So I'm going to go ahead and demonstrate with Michael here. So you're going to sit, and I'm going to ask you to reach out in front and touch my hands. And bring them back to your chest. Touch my hands. Back to chest. Touch my hands. And back to chest. The next one, we're going to go overhead. We're going to do the same thing. So touch my hands. And bring them back to your chest, up, back to chest, touch, and back to chest. Next exercise is going to be out to the side. So touch my hands, and back, touch, and back, touch, and back. The next one is a little bit more complicated. We're going to incorporate cross-body motions. So it's best if you can tap on the opposite hand from you. So I'm going to tap on his right hand. And I'm going to say, touch my hand with this hand. So touch and back, touch and back, touch, and back. And then we'll do the same thing on the other hand. So touch my hand with this hand, and I'm pointing to his hand. Touch, and back, touch, and back, touch, and back. The next one is just bicep curl. So this one isn't going to incorporate a touching motion, but it's going to be him mirroring my motions. So I'm going to use this prompt. Do what I do. Up and down. Up and down. Up and down. And then we're going to do that same mirroring motion for wrist circles. So I'm going to sit directly in front of him and hold my wrists out, being sure that it's a loose fist. So you don't want any tension in the wrist when you're doing this. So do what I do. I'm going to do circles. 1, 2, 3, 4, 5. And then for our final motion, you can put your hands down. For the final motion, we're going to be doing touching the fingers. Sorry, I gotta wake that up. Okay, so starting with a fist, you're gonna open and try to touch my fingers with yours. Make a fist. Open, touch my fingers, make a fist. Open, and close. And that's it. One important note that I want to say is when doing the shoulder motions, if your loved one does not have a lot of range of motion, so say that they can only make it here when your hands are here, you want to bring your arm down to meet them. What you don't want to do is take the hand and try to bring it up. You don't want to do that because that can end up causing damage to the shoulder. So just make sure to meet them where they are. Their own motion is what's most important, and we just want to make sure that they are engaged and doing it safe without injury. So I hope you enjoy. As far as how many to do, if you can keep it consistent, I would say somewhere between 5 to 7 reps each would be ideal. Thanks for watching.